Welcome to our webinar titled Living with MDS, a patient panel discussion. Thank you for joining us. My name is Lee Clark, patient educator, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generosity of our corporate sponsors and our generous support from our patients, families, and caregivers for supporting the webinar program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the program. If you are unable to view the webinar online, you can call in to hear the audio portion of the program using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. During the presentation, please be sure to type in your questions and answers for our panelists. To do so, open the Q&A window in the lower part of your screen. Type your question in the small text box window, and when you have finished typing, just hit enter. We will do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help us manage the incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our panelists cannot answer any specific questions related to healthcare as they are not medical professionals. Our panelists today, we have Joan Powell and Maureen Ratcliffe. So Maureen and Joan, it is a pleasure to welcome you guys today. Thank you so much for joining us and being our panelists and sharing your experiences and your journeys with MDS. So I'm going to let you guys go ahead and just give a brief introduction. Joan, would you like to start?
Good afternoon, everyone. And I call anyone that I talk with and share my journey with that are patients that have MDS, that we're all in the same family. So I've been an MDS patient since 2014. I was diagnosed, I share my story and tell them it was on Halloween, and I was giving out candy to the little trick-or-treaters, and at the time, my hematologist called me and said, I finally got the results in. It was a 6-month journey before they were able to diagnose my disease. So I was in the hospital having transfusions, having all these tests for a period of 6 months. And the greatest fear was that I was going to go to sleep at night and not wake up because they couldn't diagnose what it was. So finally they made that diagnosis. And they said, you have MDS. And I said, multiple sclerosis? And she goes, no, Joan, MDS, get a pencil and write it down. Well, she must have repeated the words over and over again. And finally I spelled it. And she says it's a rare form of a blood disorder affecting your bone marrow, whereby your cells are being produced, the red cells, but they don't have any longevity. She says, but I'm not going into detail. I said, well, thank God I don't have cancer. She says, oh, hold on, Joan. You're in the blood cancer family. She says it's a treatable disease, but in your case, there's no cure. And I'm like, what? So she said, come in tomorrow, but promise me, don't go on the internet. And I said, okay. Well, as soon as I hung up, I went right on the internet. I saw pre-leukemia, smoldering leukemia. Robin Roberts from Good Morning America had it. So I went to my closet and got a teddy bear and just cried myself to sleep because I just didn't know. So the next day she went in, and I shouldn't have done it. I shouldn't have went by myself. And she was explaining, the treatment, the transfusions and all that. So I tell everyone now, I've come a long way since that first diagnosis on October the 30th. I'm a patient advocate. I'm on the patient council here at the AA and MDS International Foundation. My passion and my mission is to put our disease in the forefront. And I'll conclude by saying I've been from the beaches of California to the steps at the Capitol, just talking about our disease, and not only our disease, but adequate health care for patients of ourselves and of other diseases. So that's my little brief story, but I'm sure I'm going to have more to add later on. Thank you.
Thank you so much, Joan. Maureen?
Hi, I'm Maureen Ratliff, and thank you all for attending the webinar. I had been being monitored for almost a decade for low platelets. And I had not been symptomatic, so we never went ahead with a bone marrow biopsy or anything. And my doctor pretty much said, you know, this may just be where your body likes to hang out, and we'll just keep monitoring you. And then in May of 2018, we had finally decided, because of a downward trend in my platelets, to finally go ahead and do the biopsy. And unlike Joan, I was not in the best medical hands. And so I had that biopsy in May and was told that it was, you know, non-conclusive. It's just where I'm at. We'll just keep monitoring you. And so I kind of went along my merry way thinking I was okay. And when I went in for my 4-month checkup after the biopsy, they ended up coming in with a piece of paper that was my cytogenetic testing, which stated I had a chromosome abnormality associated with myelodysplastic syndrome. And my doctor unceremoniously gave me that piece of paper and sent me on my way, and did not say I had MDS. And I, like Joan, as soon as I got home, got on the internet and started researching everything. And I was like, oh my gosh, this is horrible, you know. And I just researched and came up with a bunch of questions, and made a return appointment for that doctor, and had to ask him point blank, do I have MDS? And he finally said, yes, you do. And I proceeded to get a referral to another specialist who I had not as bad of an experience, but still not a very informative experience. So it took me probably about a year to find the doctor that I'm with now, who has, you know, been educating me and treating me. And so it's been quite a journey.
Thank you, Maureen. Prior to your diagnosis, looking back, were you having symptoms that, looking back, you say there was something wrong and you just didn't realize? And what were those symptoms? Joan, would you like to start?
I was a very busy person. I'm involved in a lot of organizations. At the time, I was retired when I was diagnosed, but very busy. I was working on a big event for one of the organizations, and I complained to my sister, and I said, "Boy, I'm so tired." And I said, maybe because it's all this work that I'm doing. And she goes, you need to go see your doctor. So the next day I went to the doctor, and he said, well, let's do some blood work because you look awful pale, and your heart's just really beating fast. So the next day he called me and said, go straight to the emergency room. Your blood count is down to 5.5. You're subject to have a heart attack, and just go right there. So to make the bottom line, just to sum it up, I've always had a problem of anemia. It's in my family history, but never to the point whereby I couldn't take some iron pills or eat some, you know, greens or salad or spinach and boast it back up. So anyway, they did all these tests on me, and they kept asking me all these questions like, you're so healthy otherwise, we don't understand what's going on. They gave me 3 units of blood, and they told me to go home and go see my doctor on Monday or Tuesday, because over the weekend that it happened. And then I went to see him, and he says, well, we're just going to get your count on a regular basis. So I want you to make an appointment with Quest. the lab. So I did. So he said, we'll give you a couple of weeks. Well, a couple of weeks I went, got the results back, got the call again. Go right back to the hospital. Your count's now at 6. So basically what I want to say is I always had a history of anemia, but not to this point. And they explained to me, your bone marrow is producing those red cells, but they don't have any longevity. So what they call it is a ring fibroblast, whereby I have too many iron particles around my blood cells. So that's how I say, well, I had a history of anemia, but not to this point, whereby it was diagnosed with a more severe case of anemia. So that's what happened to me.
Thanks, Joan. Maureen?
In contrast to Joan, I was not symptomatic. I have my blood monitored often for a thyroid condition that I have. So if I wouldn't have been getting my blood work done, I would not have known. And my red blood cells are not involved. So I am not anemic. I still do feel fatigued, but I've kind of been tired my whole life. So I don't know if I can attribute it to MDS, but with my white cells and my platelets being involved, I have not had symptoms even to this day. Sometimes I'll get a few bruises, but it's nothing very serious.
Thanks, Maureen. We have a question. Did you have a bone marrow biopsy to confirm your diagnosis, and how many have you had since then? Maureen, would you like to start with that one?
Sure. Yes, I did have the bone marrow biopsy, which was the definitive tool for my diagnosis. And I am in a clinical study, so I have had 8 more biopsies since then. I just had my 9th one last week, so I am a frequent flyer.
Thank you, Maureen. Joan?
Yes, I had my biopsy a month before I was diagnosed. So I guess that's September, diagnosed in October. But I'm fortunate. I've only had one so far. And I asked them how often. It's been since 2014. When am I due for the next one? And they said, when we start seeing something totally different in your counts. Right now, everything is based on your red count mostly, because right now your MDS is just affecting your red cell count. But if we see a difference in your counts or something just doesn't seem right, we are going to ask you to do another bone marrow biopsy.
Thank you, Joan. After your diagnosis, what treatment options were discussed with you? Joan, would you like to start with that one?
Well, there was hardly any options, because I had to have blood transfusions because my counts were always spiraling down. So I started out with having a blood transfusion about once a month. Then it went from 6 to 8 weeks. And I must admit, this medication that I'm on now, I'm being able to stretch it out to 12 weeks. So to me, it's a miracle, because at the hospital, everyone knew my name. Hi. And, when I go to the Quest lab, it's like, hi, Joan, how are you? And other patients are looking around me like, wow, what's wrong with her? She's got to come in here. And they know her that personally. But yeah, so I'm on a medication that I take every 21 days. It's called Lupricant, Reborol. I'm not good with pronouncing medication. So every 21 days, I take that. I inject it in my abdomen. But I've been on a lot of medications since 2014. I think this is the 4th or 5th one that I'm on. But my steady thing is every 90 days or every 3 months, I have to go to the hospital and get 2 units of blood.
Thanks, Joan. Maureen?
Initially, I was on what they call watch and wait, where they are just monitoring your blood values. And I was doing that for almost 2 years. And during that 2 years, there was talk of eventually I would need either Vidasa or Dacogen. which are 2 drugs available for the treatment of MDS, and that I would most likely need a stem cell transplant. And they pretty much told me it's not if, it's when. And, so I didn't really like that, but I was able to hold things off for about 2 years. And just in July of 2020, they ended up putting me in the clinical trial for the oral form of azacitidine, also known as Vidasa, along with another medication to help it be absorbed into your body more. So I have been on that treatment for a year. And while it hasn't put me into remission, it's kept my numbers stable enough so that I can just continue on it until it's no longer effective.
Thank you, Maureen. This question is for Joan. Since taking the luspatercept, have you had any side effects?
None whatsoever. I'm just so thrilled. And to my amazement, my specialist, the City of Hope, had told me about this drug that was coming out, but it wasn't FDA approved. And he said, you'd be the perfect candidate for it. So I had to wait almost a year and a half before it was approved. So I've been on it since March of 2020. So far it has extended, as I said, my transfusions to 90 days. And that's, to me, that's all I can ask for right now. Since I'm not a candidate for a stem cell transplant or a transplant. So right now I'm happy at this point. Not thrilled, but happy.
Thank you. This question is for Maureen. Why did your physicians not suggest using the IV or injectable Vidasa instead of just putting you on the oral Vidasa?
Well, at the hospital that I go to, they were doing the clinical study for the Dacogen, the oral Dacogen, and that had was just getting into the final phases for approval. And so they were also conducting the Vidasa side of it. And really, it's just for convenience sake, which is why they want to bring it to market instead of me having to go to a transfusion center or hospital. I get to take, they give me the pills when I go to the hospital. I have 2 different kinds, and I take them at home. And so I don't have to worry about going in anywhere. I don't have to get shots or have a port or anything. So it's really for convenience.
Thank you. And have you been having any side effects, Maureen?
It has taken some fine tuning. In the beginning, it was hard with the nausea, and I had to get the medications fine-tuned for that. And now it's kind of turned into more GI symptoms where I'll have some cramping and maybe some diarrhea or the other. But overall, I mean, I have been very thankful and feel very blessed to be on it. And I feel like it really has been, the side effects have been so minimal that, I don't feel like they hinder my quality of life at all.
Thank you. This question is for Joan, and it reads, Joan, when you get a blood transfusion, do you know if the blood has been genotyped for you?
Yes, I have to go the day before for a cross match, and it's required, just so, nothing goes askew, I should say. But yes, they test it. And I'm fortunate I have O positive. So I'm compatible with a lot of donors. And I tell people, if you have any issues regarding race or religion, it doesn't come to play when you're getting a transfusion, because you don't know where who the donor is. So I'm just so thankful for those people that donate blood. But yes, they do test it. It's very important. And I haven't had, so far to date, I haven't had any problems with my transfusions, none whatsoever.
Thank you. And Joan, this is for you as well.
Mhm.
Have you been diagnosed with iron overload from having transfusions? And if so, how is that being treated?
I've been giving a medication called XJ. It's a couple pills I have to take on a daily basis. And I take it with the orange juice because, of course, with all the transfusions over the years, that iron just builds up. And people say to me, well, Joan, why don't you just eat take some iron pills and eat a lot of foods with iron? And I'm like, I don't need those foods because I have too much iron in my system. Sometimes it does give me a little bit of diarrhea off and on, but the fortunate thing is my iron count has come down because of the fact that I don't have to have as many transfusions like I used to. So that's been a blessing. Mhm.
Thank you, Joan. And Maureen, this question is for you. They'd like to know, are you still a candidate for a bone marrow transplant now that you've participated in a clinical trial?
Yes, I still am.
Thank you. And our next question is, the question says, where are you being treated where are you both being treated at what hospitals? Joan, would you like to take that one first?
Sure. I must admit, I'm in a beautiful area in Southern California called Laguna Niguel, which is near Dana Point. It's in Orange County. And I'm so fortunate. That's why I'm a fighter for healthcare, for all zip codes, to be in an area where I have some, to me, very qualified and fantastic medical team that has been working with me. So I go to the hospital, it's called Mission Hospital, which is in Mission, Viejo, California. And I've been going there since 2014. Well, recently they built a cancer center across the street from the hospital. So any sort of transfusions, they started doing that about 3 months ago. It's what do you call it, upscale with all the latest technology. So I'm very fortunate. My doctor is very compassionate. And I have a patient portal that anytime I have a question, he gets back to me within a couple hours. So I'm very, very fortunate where I am in Orange County, California.
Thank you, Joan. Maureen?
Well, I am on the other side of the United States. I am northwest of Atlanta, and I actually travel up to Vanderbilt University in Nashville. And the quality of care I've gotten there has been phenomenal. And they have been so responsive and I don't know, I just can't say enough good things. And, that is one thing that I've learned over this journey is that, the first medical professional you meet may not be the right one for you. And it's really important to keep going until you do find that doctor that you feel comfortable with, who you feel listens to you and educates you and, where you're not just another number or, just, okay, any questions, and wants to get you out the door. So it's really, really important to keep going until you find someone who you're happy with.
Thanks, Maureen. This question goes to both of you. Have either of you had any support for platelets? And at what point at what point was your platelet count that required the support? Maureen, you want to take that one first?
Sure. I fortunately have not had to have any intervention with that yet. Mine have not dipped below the 50,000 mark. So I have not had to have any transfusions or anything like that.
Thanks, Maureen. Joan?
Yes, I like Maureen. It has not affected my platelets. MDS, there's various syndromes of this disease is centered around my red blood cells at this time. So my platelets seem to be normal. I mean, they go up and down, but most of the time they're normal.
Thank you. This question goes to Maureen. Did you have a drop in counts during your course of treatment? And if so, what did your medical team advise?
Yes, I absolutely did. And on cycle 2, a couple of days in, I ended up in the hospital for a neutropenic fever. And I was there for 4 days and had to have intravenous, please excuse my cat here. I had to have intravenous antibiotics and was released with a PICC line and other oral antibiotics. So I definitely did have a big drop then, and still even for several cycles, I was down under 0.5 for my absolute neutrophil count. So I was considered in the danger area, but fortunately, no infections developed. So now they're when they get to their midpoint, they call that your nadir, where they dip mid-cycle. I'm about 0.7, 0.8 with my neutrophil count, which still isn't great, but it's good enough for me to get by and not need any antibiotics. I am on an antiviral all the time, and I'm no longer on the antibiotic.
Thank you, Maureen. This question is for Joan. Before using luspatercept and blood transfusions, did your medical team assist you in any other way with other treatments?
No, I started out with a medication called Procrit. I went to Aranesp, Revlimid, and there's probably another one or two that I kind of blocked out of my mind. But most of them were self-injections. And I remember when I first started out with Procrit, I had to inject myself 3 times a week. I didn't like needles. I had never done it before. And I thought, well, maybe I could just go to the doctor's office. And he goes, nah, you're going to have to learn how to do this by yourself, which I've done. And even my latest medication, most of the people that are on it tell me they go to the doctor to do it. But I guess he had confidence in enough, and I've been injecting myself since 2014, that I self-inject myself with the needle in my abdomen. So I've been on quite a few medications to try to stimulate my bone marrow. But as I said, the last one that I'm on now seems to be working the best, and the transfusions. Yeah.
Thank you, Joan. And Maureen, this question is for you. What factors have you been told that will help your medical team decide when you are ready for a transplant?
Well, it's the stability in my numbers and with my white cells and my platelets, which they feel like I am at a stable point, but I'm just not ready to make that leap yet. So, they take so much into consideration for it. Like, I'm on the younger side to have MDS. I'm 53. So because of my age, and I don't have any comorbidities, and, if my numbers are at a stable point, which I don't know exactly, what number they're looking at, like, I know the bloodlines, but I don't know exactly, what would tip me over the edge one way or the other, but they feel like it's stable right now. But just because of the risks of a stem cell transplant, I'm just not ready to make that move yet. So I'm just continuing on the treatment that I'm on.
Thanks, Maureen. And Joan, this question is for you. How long have you been on luspatercept, and what dosage are you taking?
I I started in March of 20, and for about 6 months, I was on, I think, like 25 milliliters. I don't know how, as I said, I'm not good with medication. But I told my doctor, and I'm an advocate, you got to be your own patient advocate. It's all about your body, okay? So I said to my doctor, I said, I think you need to increase it to the maximum. I'm not having any problems. He said, you sure? I said, yes. He says, well, I don't know, based on your weight. I only weigh about 110. He said, we're going to see whether or not they'll approve it. So they did. And I'm on the maximum, 75 milliliters I take. So, and it hasn't really affected me at all. And that's the maximum you can take. You can't take it before there's 21 days. It has to be every 21 days. So yes, I'm at the maximum.
Thanks, Joan. Maureen, this question is for you. And this question would like to follow up on, you made a comment about neutrophils. This comes from a patient that was unable to do their chemo the past week because of low numbers and was told to follow a neutropenic diet. Has this been mentioned to you? This person was diagnosed with MDS just a few months ago.
I am familiar with the neutropenic diet. None of my doctors have ever recommended that, but I am familiar with it. And, you know, I think it's always good, you know, with your neutrophils being affected, to take as many precautions as you can, because you just don't know what is going to, you know, produce an infection. So I haven't followed it myself, but I've read up on it, and I've heard it recommended, you know, for other people.
Thanks, Maureen. Joan, this question is for you. How often are you having blood draws, and does that monitor your luspatercept levels?
Yes, as I keep telling you, you got to be your own patient advocate. You know, everyone has their own journey, and I've done a lot of research. I've a lot of conferences that I've attended to, being involved with, you know, the organization that's presenting this. But I go about every week. Every so often I'll skip a week, but it's more for myself than probably my doctor, because I just want to know where I am. And he's on vacation this week, and I had my blood work done on Monday, and I sent him something in the portal. I didn't know if he was going to answer it, but last night he responded back at what my counts were. So yes, I don't care what medication that you're on. You need to monitor it yourself along with your doctor, just to see the difference from month to month, from 3 months for a year, or whatever medication you're on, just to get an idea if the medication is working for you. Don't wait for them. You do your own checking.
Thank you, Joan. This question is for Maureen. What led you to participate in a clinical trial? Was this recommended to you, or did you find the trial on your own?
It was recommended to me by my doctor. I did not find it on my own. And really, since he recommended it, he felt like because my white cells and my neutrophils were steadily you know, in a downward spiral, that it was time to start treatment. And so that's why he recommended that trial. And, you know, granted, I could have done the other forms of Vidasa, but, you know, again, for the convenience sake, it just was, you know, it's easier to do it. And I do get a lot of extra monitoring. Like, sometimes I'm not so happy about the number of bone marrow biopsies that have been required, but on the other hand, there's been that constant surveillance. So I know where I stand, and, just with the criteria and what they require, I think it just gives a little extra security with that, with more monitoring. And I don't do as many checks as Joan does. At the beginning of my treatment, I did. But now they just monitor me mid-cycle. I go every 6 weeks for my treatment. I take my pills 5 days every 6 weeks. And so they do the blood work that day that I get my pills, and then they check me mid-cycle. So I think I answered that question.
Thank you.
Not sure.
Thanks, Maureen. Absolutely. And this question goes to Joan. Has your doctor discussed with you a plan B if the luspatercept stops working for you?
No, he has not. I go see him on the 27th of August. But as I say, I do my own research. There's a lot of other clinical trials that are out there for persons of ourselves with MDS. And even though I don't see my specialist anymore, if there's necessary, I'll make a call into him and set up another second opinion. But what has been very supportive of me is I belong to a support group in Carlsbad, California, whereby there are family members, I call them MDS members, that have MDS. So we share stories. We even have specialists from the San Diego area that specialize in MDS, where I get a lot of information from, and that's free because they want, like today, they want questions and things like that. So that has been very, very supportive in my care. And I think, right now everything seems to be working fine, but I'm going to bring it up probably in a couple of months. What happens if this stops working? So that's a great question, whoever asked that question.
Great. Thanks, Joan. And now this question goes to both of you. Both of you have mentioned about being your own best advocate and the importance of finding a specialist in MDS. At what point do you realize, or did either of you realize previously you were not in the right place and that you needed to find another doctor? Maureen, you want to take that one first?
Yes. The beginning with that diagnosis was just so, I really felt like it was medical malpractice or negligence, because that piece of paper that they gave me, they should have given me a couple of weeks after my biopsy, and somehow, I know we're all human and mistakes are made, and thankfully I didn't have a disease that where time, was of imminent essence, so that I don't feel like my disease progressed within that time. But it was just with that doctor, it was finding out, that he wouldn't be honest with me. He wouldn't be straightforward. And then I just felt like he didn't have the knowledge, because he's not an MDS specialist. And I think, not every hematologist is familiar with it. So you do have to find someone with that knowledge base. And when I was referred to the second one, she may have had more knowledge, but it was still that bedside manner that was lacking, and the lack of information, and just kind of the callousness, just like, okay, here it is. This is what's going on. Okay, any questions? And it just it was so lacking in just what you expect from someone. So I actually went through to a patient forum through another MDS organization, and the doctor I have now was the keynote speaker. And we were just, my husband and I were just blown away with his knowledge base. And he is an active researcher in MDS, and he was telling everyone at the forum what to tell their doctors, you know, or to ask their doctors. And so it was like, gosh, if this man is telling us what to look for, I want him as my doctor. And thankfully, he took me on, because he said anybody who came to a forum, he would take on as a patient. So it really is just finding that combination of the knowledge base and the bedside manner and your comfort level with someone.
Thanks, Maureen. Joan?
One of the most important questions that you should ask your hematologist or oncologist is, how many patients are you serving that have MDS? Mine has a few, but not a lot. So that's the key to itself. So that kind of put me into a reality, well, I need to find somebody that specializes in this disease. So what happened to me was, I guess they were giving me all this medication. One day I went in for my visit, and the doctor said to me, my hematologist, "We're giving you the max and it's not working." Well, I had a breakdown in the office. I was crying. My sister was with me at the time. So she said, "Well, we're going to send you to a specialist, either one in San Diego or one in Los Angeles." And she said, and they're going to look at your records, and we work hand in hand. So that's what they did. But I got a call from the specialist office saying, "Yes, you're coming in here to consult with a specialist regarding a stem cell transplant." Well, then once again, I freaked out, because I said, "What are you talking about?" So I called my doctor back, and she says, "Well, Joan, you know, to be honest, you have to write things a certain way in order for insurance companies to approve. So with this disease, it's so rare." I said, "A lot of times we have to go to the extreme in order for you to see a specialist." So I said, okay, and that's what I did. But I think the thing that really made me realize that you have to look out for yourself and find specialists, be it one or two, is I went to a conference in San Diego, and one of the doctors, who was a specialist, the patient asked, "How do we get this disease?" Well, no one knows how you get MDS, because it's so different for everybody else. You know what he said? He says, "You all just have bad luck." Well, I didn't take that as being very funny. So that put me into the advocacy role. I started, reading more, going to a lot of conferences, whatever it was sent to me about MDS, I tapped into it. So, but yeah, I haven't had any problems with my doctor. It's just that I'm my own patient advocate. I know I keep saying it all over again. Any conferences that come up, be it with our foundation here or other foundations, I try to tap into.
Thanks so much, Joan. And this question comes from a patient who was diagnosed 6 weeks ago, and they have a follow-up with their doctor, their first real appointment to discuss their disease and their treatment options. What questions should a newly diagnosed patient ask at their appointment? Maureen, would you like to take that one first?
Yes, that is a very good question. There's so much going on when you get that initial diagnosis. I think at that point, you're just so overwhelmed with the information you've given. It's important to know what subtype of MDS you have, because that's going to determine your treatment options. So I would want to know my subtype, and also what they call the IPSSR score, which places you on a scale for what risk you are, which also is very what's the right word? Predictive may be a strong word, but of how your disease may progress and what your treatment options are. I mean, I would ask any questions that you have about your blood work. You know, what does my hemoglobin count? What does that mean? You know, what is a hematocrit? What is my ANC? You know, just any questions you have. I would, you know, I would start with those main ones, but also any questions you think of, write down, because when you're in the midst of that appointment, it's very easy to get information overload or just emotionally to get overwhelmed with the information that's being presented. And I would take someone with you, you know, so that they're hearing the same thing. So if you kind of tune out, they're there and they've heard the same thing you have. So that would be where I would start.
Thanks, Maureen. Joan?
I would echo what Maureen just said. I would, she said, take someone with you and have that person take the notes, because you're going to be kind of like a basket case, probably, maybe not. If the doctor allows you to record, that's fine. I wish I had did some, even though I was on the internet, I really wasn't really reading, you know, it was Greek. But now that you've had some time to kind of like digest the fact that you have this disease, there's nothing wrong with going on our website here and, you know, getting a summary. They have great resources out there on the internet that talks about the different low, mediate, intermediate, high risk, you know, the different types of treatments that you might have, talks about the medications that are out there. You know, it gives you a lot. You might be a little overwhelmed, so just take a dose at a time. But I think the greatest question that I had to my doctor was, how long am I going to live? Because she said there was no cure. That was my question. There's just treatment. So that was mine. And to be honest, I don't really think they could answer that, but they just say, in order for you to be treated, to live, you have to be treated. It's nothing that you can just say, oh, I don't want a transfusion, or I don't want this, or I don't want that. So I would say, take someone with you, like Maureen said, take a notepad. If you can record the information, it's great. Do a little research on your own. But we're witnesses, we're living with this disease. So it's not like, you know, 6 months, you know, based on what we know, you're going to survive for a while.
Thank you. Do either of you participate in support groups? Maureen, would you like to start with that one?
Yes, I actually, through the MDS Foundation, and have just started facilitating one. So you know, support groups are so valuable. Pre-COVID, we had been trying to start an in-person group, and it was taking some time to get it off the ground, and then COVID hit. So that went by the wayside, but I would definitely get involved in a support group, because I tried a more, I'll say like a traditional cancer support group where, you know, with breast cancer patients and other type of more tumor-like cancers. And, you know, even though the people were wonderful and compassionate and understanding, MDS is just its own unique entity. And people who aren't familiar with it really have a hard time with it. You know, it's kind of the saying, you know, oh, well, you look good, you look well, you know, and they just don't get it. And, you know, MDS doesn't have stages, and, you know, it's its own ball of wax. So I would definitely recommend any support group that you could find being a part of it, because it really does help to have people who can relate to you on your level with what you're experiencing, you know, to be able to have that, and also to give that to other people, what your experience is, you know, to help somebody else along the way.
Thanks, Maureen. Joan?
Oh Yes, most definitely. As I said, I call my MDS family. I've been with them for about going on 3 years, like a life support. Sometimes you get on, you might not be feeling your best. And sometimes I share this story with most people. You have MDS, or you're at your point where you take a shower and you got to come out of the shower and lay down for about 10 or 15 minutes because you're so exhausted that you can't put your clothes on. So little things like that, and have someone else to say, yeah, I feel the same way. Or people saw me the other day at an event and they said, boy, you look really great. Are you really sick? And you say, my disease is invisible. You can't see it. So it really, I call it a lifesaver because I didn't know anybody with MDS prior, just what Robin Roberts, and I don't know her, but it's very, 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 and most of the people that have this disease are very friendly people, very patient people, very understanding people. So yes, if you can find one, I think there's something in the works here with the foundation that, yeah. And if you can't go every time they have a meeting, just go when you can. And you develop friendships out of that too, whereby you might have one of your peers that you can call and talk to sometime. So yes, most definitely. And most important thing is you don't have to say anything. You can just sit back and listen to people. You don't have to feel like you're on stage or anything like that.
Thanks, Joan. And we had a question about how do you find the support group? So our support groups are virtual, and you can find them on our website, which is aamds.org, and it's underneath the support tab. And also, if you're on the webinar, you will be receiving from us an email that comes out about how to register for all of the groups. So thank you so much for that. And we have a question. Did either of you receive the COVID vaccine? And what was the advice you received from your physician? Joan, would you like to start with that one?
As I said, I'm on top of my life, okay? So I sent an email to my doctor and I said, I'm 99% sure I'm going to get this shot. Do you recommend a certain one, Johnson & Johnson, Pfizer, or, Medina? And he said, no, it's up to you. But I decided that I was going to have the 2-shot process. And I did have Pfizer. And I asked my doctor, was there anything that I need to look out for? Because you hear so many different versions of getting this shot when you have a compromised immune system. I felt there was no choice in the matter, that I had to get the shot. So I did get it in February. I got it at one of the universities out here. And I remember the first shot was Valentine's Day. The second shot, I can't remember. The effects were my arm was sore. I was kind of out of it for like the second shot. First shot, I had no problem. Second shot, my arm was a little sore. I was a little kind of like out of it, a little temperature maybe or something like that. But I am so glad that I received, because we have no choice in the matter sometimes. I mean, there is a choice, but our immune system is compromised. So my blood count, I must admit, went up kind of high after I got that second shot, and I was totally amazed. So someone said it might have been the antibodies or something like that. But no, I've had no problem since I've had that shots, I should say.
Thanks, Joan. Maureen?
Yes, my doctor recommended that I did get the shots, as soon as I possibly could. So I had them done locally. I did Moderna, and, I'm really thankful that I did it, even though we still have to be careful and really still should be masking up. I still felt a little bit of liberation over COVID there, because with us, it really can be serious if we do contract that. So, I don't think there was ever a question about if it should have happened. It was just more, do it as soon as you possibly can.
Thank you. And since your diagnosis of MDS, do either of you travel? Whether it's plane, train, go on vacations, and how do you keep yourself safe even prior to COVID while traveling? Because sometimes you You never know whether you may need treatment. Joan, would you like to start?
Yes, prior to COVID, I was doing a lot of traveling, and I must admit a lot of it was due to patient engagement organizations. I've been asked to speak at various organizations, give presentations. So I was traveling quite a bit. I didn't really have to, my fear was more in taking my medication with me. So my medication had to be on ice. So I would take a note from my doctor. I also would have a copy of the blood work needed, even though it's in the Quest system. And yeah, I would take precautions. I wasn't wearing a mask at that time or anything like that, but I was just very, very conscious, not eating at buffets or anything like that. So I was just very conscious. So since COVID, I haven't did that much traveling. I took a vacation about 2 weeks ago to visit my sister in Florida. And the masks, I have a tendency to wear gloves more so than other people like that. I usually do errands early in the morning, grocery stores and things like that. But as far as travel, I love to travel. I can't see myself at this time going overseas or to the islands. But within the continental United States, as I said, I was telling them earlier, I'm hoping to go to Las Vegas next month, but it's also based on this Delta variant that has come out. But now I got to keep living. I just got to keep living.
Thank you. Maureen?
I totally agree with that. You've got to keep living, and I don't think you can ever be 100% certain, by what you do, and all you can do is try and be safe. So I did go to Colorado at the end of May. And so I flew there and just took the normal precautions, mask, hand sanitizer. I took some wipes with me in case I needed to wipe anything down. And the trip went well. I'm planning another trip back there because my daughter and her family live there. And so I'll take those same precautions. And, pre-COVID, I was just always cognizant of the hand sanitizer, whenever I would go any place. When I got back to my car, I would sanitize. I never touch my face, like my eyes. I'll use a tissue or something. I always wash my hands immediately when I walk in the door. And, so just the basic stuff that we're taught to do, and I just echo what Joan said. I know it's different for everyone and we all have different thresholds, but I don't want to live in fear, but I do try and be smart. And I have, even before COVID, was kind of isolating, more so than an average person, just, to keep well.
If I can just add one thing real quick. When I travel, I use the wheelchair accessibility. There's no shame in having someone push you up to the gate, and a lot of times you get on first. But sometimes I'm so tired, or I know with my disease, some of those terminals are like, you got to go from here, take the tram and all that. So that's what I do, and I usually give them a tip. But that's something you can do when you do travel.
Thanks, Joan. And we have a question that says, do either of you wear an ID bracelet with MDS listed? Joan, would you like to go first?
I've got 3 of them. I have 3 of them. I have cards in my wallet. Yes, I have a disabled, I was fortunate enough because we do have a compromised immune system that within the state of California, I qualify for a disability tag. Also, real quick, your energy, your gas and electric, you can get a discount on that, not based on your income, but based on the fact that you have a compromised immune system. So you might have to use more energy, air conditioning this summer. You might have to use more heat because of the fact that, being a part of the anemia family, the blood family, you might need more assistance in that area. So, talk with your doctor or call your utility companies and see if that's available also.
Thanks, Joan. Maureen, do you wear an ID bracelet?
No, I don't. And, I've thought about it, and it's something that I think that I should do, just in case something happens. I think it's a great idea.
Great, thank you. And our last question is, has either of your doctors discussed with you about the possibility of receiving a COVID vaccine booster? Joan, would you like to go first?
No, he hasn't. But I talked with my primary physician because I don't see him to the 27th. But I just know in the research that I've done, it's a no-brainer for me. I would get the booster shot.
Thanks, Joe. Maureen?
We haven't talked about it yet, but I'm of the same mind. I will definitely get one if it's possible to do so.
Thank you so much, Joan and Maureen, for spending your time with all of us today, sharing your expertise and all about your stories and your journeys to be so helpful to other patients and families. Thank you both so very much. If you'd like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If we were not able to get to your question, you can always send it to us in 3 ways. Send an email to help@aamds.org. Give us a call at 800-747-2820, extension 2, or submit your question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. On behalf of our medical advisory board and team, we are always here to support you and your family as we've done for the past 37 years. This concludes our program. Thanks again, Joan and Maureen.